Good morning, ladies and gentlemen. Welcome to the Compliance Online Live webinar. Today's topic is how to perform a HIPAA risk assessment. Our speaker for today is Jim Renner, has over 40 years of experience in assisting healthcare organizations, both the providers and payers, identify their automation requirements and helping these organizations select and successfully implement the automation most applicable for their needs since 1996. He has been an active lecturer, trainer, and a HIPAA assessment consultant, assisting a variety of healthcare providers, hospitals, payers, clinics, and individual physician practitioners become HIPAA compliant. He developed the IBM HIPAA assessment and training products for their consulting practice. Mr. Renner is a certified HIPAA consultant and has authored articles regarding various topics on this subject. Jim, please go ahead.
Good afternoon or good morning to you, and thank you for joining us. I'd like to move on to this discussion and see if we can get through the materials that we have to go through on how to perform a HIPAA risk assessment. Primarily what we want to talk about is the references of what we look for and how we do it, why you need the assessment, who needs to perform a HIPAA risk assessment, how it fits into your overall HIPAA compliance program, what is an assessment itself and how to prepare for it, and then we're going to talk about how to perform it and how to interpret the results of the risk assessment. So from the standpoint of the references, the key things that we look for, the key things that we talk about are the HIPAA security regulations, which are the 164-300 series, the high-tech breach notification regulation, which is 164-400, the privacy regulations, which is 164-500, and then I recommend to you that you look for the National Institute of Standards and Technology, referred to as NIST, their Information Security Guide. I refer to that because that's basically the reference that HIPAA uses as a standard for performing the risk assessment itself. So I suggest you take a close look at that or have somebody look at that for you. So the question now gets down to who needs to perform it. And anybody that sees patients, as you can see in this list of providers, is basically considered a covered entity and needs to perform a HIPAA risk assessment. And then also the business associates have to perform one. In the omnibus rule, they made it clear that the business associates have to comply with the same level of responsibility and standards in their HIPAA compliance that a covered entity has to do. In other words, if you're a business associate, you have the same responsibilities and the same liabilities that a covered entity has. And I have performed assessments and compliance programs for business associates who basically want to be in the game. So if you're, I like to identify that the software vendors are HIPAA are business associates. Same thing with a billing service or a lawyer or accountant. If the lawyer or accountant is actually seeing patient health information. So if they're doing billing for you or they're performing certain services that require that they see a patient's health information, then they have to be considered a business associate and have to perform many of the same responsibilities. I like to include the cleaning services for organizations. In many cases, a cleaning service comes in at night, and sometimes the computers are off, sometimes they're not. In most organizations that I have seen, reports and patient information records are usually left out on desks or in cleaning areas or areas to be cleaned overnight. So I like the idea of the cleaning service being considered a business associate. And then I like any operations consultants that you have to deal with also need to consider that. So I strongly suggest you take a very close look and have your IT people look at the risks of that kind of hacking. I spend a lot of time talking about that when I'm doing my classes and when I'm doing my training. So the next question is, what is a threat? And a threat basically is a circumstance or event that has the potential to, hurt your organization. It can affect your assets, your individuals, and basically comes from unauthorized access. One of the things that the issues you have to deal with is what is the intent of the individual to cause an event? Sometimes things happen by accident. People get in, people get out. You just need to make sure that it's covered. Business associates sometimes do not take their responsibilities as seriously as they need to. You have the issue of a natural disaster, and I have another program on disaster planning that basically addresses what the implications of a disaster are on your ability to be HIPAA compliant. So, now that we've gone through what these different issues are, what we want to talk about is how do you go about preparing for doing an assessment. First, you need to decide if you need some outside help. There are advantages of doing it yourself, and I go through this with clients before they hire me to make sure they're really doing what they need to do. First of all, if you do it yourself, you know your operation better than anybody. I don't care how many of these I have done and how many organizations I've seen. There's absolutely no way I'm going to go into a healthcare organization and know it as well as as the people that work there do. And second of all, obviously, you minimize and keep your costs down to a bare minimum. The advantage of having an outsider take a look at it is that they have experience and knowledge that you don't bring to the table that can be applicable, particularly if you're looking for some assistance. Second of all, they're going to be objective. They're not going to be biased to any particular issue. I have seen it where you'll walk in and say, oh, yeah, we have great controls, and we have this, and we have that one. And I objectively look at it, I find it's not quite as good as they said it was. Or, they really haven't done the things they said they have. They meant to, but they didn't do them. And the other issue is to maintain focus. One of the problems of doing it yourself is that that you get in, and then all of a sudden you're inundated on a daily basis with daily issues. And you have to put it off, and eventually you put it off for a day, a week, a month, a year, whatever, 6 months, and then it never gets done.